Hello students! Today's lecture is going to walk you through the most important information that you need to know about the superficial skeletal muscles, and any skeletal muscle for that matter, how they work, and how you can begin to predict what the muscle's actions are. So we're going to start our notes on this page here, and I'll walk you through the basics, and then we're going to look at some specific examples that you'll have to, and then you'll have some work to do on your own. Okay, so let's get started. Number one, skeletal muscles are attached usually to bones in at least two places and span over joints. So I think you knew this already. There's a reason why we call them skeletal muscles, because they attach to the skeleton. There's a couple places where that's not technically true. In your face, the muscles that produce facial expression, if you think about your skull for a minute, the muscles that allow you to, for example, smile or pucker your lips, those are not moving bones, those are actually moving soft tissue. But to start, we're going to look at muscles that are attached to bones, and they have to be attached in at least two places. So just for an example, this muscle down here at the bottom is the Biceps Brachii, and we can see that this is the muscle here in the red color, and it has a tendon on one end attaching it to this bone, and actually two tendons on this end attaching it to this bone up here. So we'll talk more about that later, but it's attaching to bone on either end of the muscle, and then it's actually crossing over this joint, the elbow joint, the humeral ulnar, and also this joint right here called the glenohumeral. So we'll be concentrating on what it's doing at this joint, but technically any muscle that crosses over a joint or spans from one bone across a joint to another bone will have action at that joint. So that is rule number one. Rule number two, and this is really important to help you predict the action of the muscle, is that skeletal muscles will contract in the direction of their muscle cells. And so, for example, let me show you, I don't have a double-headed arrow here, let's try this one, that you can see the grain of this muscle is kind of running long ways on the arm. So we have potentially a direct an action that would occur in this direction or in this direction, and so we have to see what is going to make sense for this particular muscle, but it's going to pull in this direction, and so you want to look for the grain of that muscle, and we'll look at that again when we do our examples. Number three, muscles shorten when they contract. Muscles do not elongate with force. They shorten with force. So if you were to go lift a barbell that had weights on it, your muscles would get shorter as you lifted the barbell. They pull closer together. And so this is what's causing the neighboring bones to get closer together, because the muscle's actually shortening like a rubber band would if you stretched it out and you allowed it to pull two things together. Number four, here's where we're really getting into the important parts. Number four, the bony attachment site of a muscle that acts as an anchor and does not move during contraction is called the origin of that muscle. So number four, really important. One end of the muscle will move a bone and one end will not. And so in just a minute, I'm going to ask you to predict for the biceps muscle, which end is the moving end? Which end is going to actually create cause a movement of a bone? So let's move on to number five, because it's directly related. The bony attachment site of a muscle that is moved when the muscle contracts is the insertion end. So really what I'm saying with 4 and 5 is that for every muscle of the body, every skeletal muscle, whether it's superficial, intermediate, or deep, has one end that will remain stable and one end that will move. And so essentially you have a decision to make. Which end is going to be the moving end? And then once you've figured that out, you can start to apply the rest of these rules to that muscle. Number 6, again directly related to 5, during the contraction, the insertion end of the muscle, I'm going to put green because it moves, is pulled closer to the origin end of the muscle, and the origin end of the muscle will not cause any movement. It'll just stay anchored. And then I'm always going to write that as this. The insertion end moves closer to the origin end. And so you'll hear me say that a million times during this unit, I to O. I moves to O. The insertion of the muscle will move closer towards the origin end of the muscle, and in that way creates a pulling effect. And then finally, number 7. Based on the previous information, that means muscles always pull two bones closer together and can never push them further apart. And I'll give you a video illustration of that. And we'll apply that rule a lot. Okay, so I'm just going to mention it now. Muscles always pull like a rubber band. They never push. They pull like a rope. They never push two bones closer or further apart. So for this reason, every muscle is going to have an opposer, another muscle that does exactly the opposite action of it. Okay, so now it's time to predict. The attachment site of a muscle that does not move during contraction is the origin, and the attachment site that does move is the insertion. So let's take a look at our arm here. We have two tendons on the upper end and one on the lower end. Which one of these is going to cause action? Is this end going to pull the scapula downward towards the elbow, or is this end here going to pull the radius bone upwards towards the scapula, creating movement at the elbow joint? And so I'm pretty sure that you know the biceps brachii causes flexion at the elbow joint. And so if that is true, which it is, this lower arm is going to raise up like this when the muscle contracts, which means this is the moving side. That is the insertion end. So I'm going to put an I right here. And this side stays stable. When you do this motion, elbow flexion, nothing occurs at your shoulder joint. This is acting as an anchor for our muscle. And so we have two origins for the biceps brachii muscle. Essentially, that's why it's known as the biceps brachii, because it has two origin points, which both happen to be on the scapula. So we'll focus in exactly where these origin points are and insertion points are when we study the muscles of the arm. But just because we're learning now, I want you to get the idea. And so let's apply our rule. I moves closer to O. So I'm going to draw an upward arrow like this within my diagram, which means that when this muscle contracts, this biceps muscle, the anterior upper arm, it causes the radius to get pulled closer to the scapula and creates the action that we would know as elbow flexion. Now, based on that, does this muscle also extend the elbow? Does it cause the arm to go back to the anatomical position? Does this muscle push these two bones further apart? And the answer is no, for a couple reasons. First of all, that would break number 3 rule. Muscles shorten when they contract. So if this muscle was going to push these two bones apart, it would have to get longer. So definitely not. Number 6, it also breaks this rule as well. If this muscle was going to extend the elbow, that would mean that the I would get further from the O, and that's not how it works. And then also it breaks rule number 7, muscles can only pull. This would be pushing these two bones apart. So we'll answer the question, how do you extend the elbow? It's with an opposing muscle that sits posterior to these joints on the back of the arm, known as the triceps. All right, so let's get our bearings here and use the app as a working model. Here's our biceps brachii. It actually has the two sections to it. Notice the two origins at the top. Remember, this end down here is the insertion, and these are the anchor points or the origin. And so this end is going to shorten towards the origin and cause a movement. The best part about this app is that we can see it. So watch this muscle shorten right here. See how the muscle is now taking up less length because it got shorter. It also is what causes it to bulge outward and become, looking like it's larger. So this end was the moving end, and this end is the stable end. Let's put it back. Now let's watch up here on the scapula side. Nothing moves up there. Nothing moves. It's this side down here that is the moving end. and the contraction causes the flexion. Look what happens to the length and the width of the muscle as we put it back. That's a stretch. Now, what would cause you to be able to do elbow extension? There's a muscle on the opposite side of the arm. That's called the Triceps Brachii. So watch as we extend the arm. Notice it works in much the similar way, where this end down here is the insertion again, and this end is the origin. So watch as the muscle shortens and causes elbow extension. It's going to shorten in this direction. So extension, see how the muscle's shortening and contracting. So if you want to flex the elbow, you're dealing with muscles on the front that will pull the lower arm to the front. If you're dealing with extension of the elbow, moving the lower arm to the back, your muscle is on the back. Let's also be very clear in making the point that this muscle on the back crosses the elbow in the back, so it pulls to the back. This muscle on the front crosses the elbow on the front side, and so it will pull the lower arm at the elbow to the front. Okay, so these are your basic rules of muscle contraction. And then let's go ahead to the back of the worksheet and we'll do some examples. So here we are. Let me zoom in. So we're really just looking at this muscle here. This muscle is known as the Serratus Anterior, and I specifically chose muscles that were a little bit less popular so that you couldn't rely on your background knowledge to know what this muscle does. You have to be able to figure it out. So let's go ahead and answer the questions. What bones does this muscle attach to? So we literally want to look at where the muscle lands on the skeleton. And so you can see for this particular muscle, right here, we have a bony attachment to the ribs, and then we also have a bony attachment to the scapula. And I'll explain to you what this little dotted line here means in just a second. So I'm going to go ahead and pull up the video of this particular muscle and let you see it in more of a 3D aspect. Okay, so here is an animation of this muscle, the Serratus Anterior, and I can rotate it here. We do have a secondary muscle on here, which for whatever reason I can't delete it, so this one's called Pectoralis Minor. Let's go ahead and ignore that just for now. As we're learning, we're looking at this muscle here, Serratus Anterior. And so we can see that it's attaching to the ribs, and then we can also see, here was the explanation of the dotted line, that as I rotate, you'll see exactly where it's attaching to the scapula. Can you see here along this vicinity? It's attaching to the anterior side of the medial border of the scapula. So as I continue to rotate, you see how that stretches right along the ribs and attaches to the inside edge, the anterior portion of the medial border. So when you see that dotted line in your notes, that's what that means. It says it's attaching to this point of the bone, but on the side that we're not able to view currently. What bones does this attach to? We're going to say that it attaches to the ribs, and we'll be more specific later on one end, and that it attaches to the scapula on the other end. So that follows the rules. Attaches to bones in at least two places. And so then the next question is, which of these bones is the movable bone? Do ribs move? Are ribs going to be pulled closer to the scapula, or is the scapula going to be pulled closer to this side of the rib cage? And so I hope in your mind you know that ribs barely move at all. And the scapula is a much more movable bone. So I'm going to answer this with the word scapula. The scapula is our movable bone. And so based on that, if you follow the rules from the first page, that the moving end of the muscle is known as the insertion, then we can go ahead and put in our eye. And I'm going to put it in a couple places because the insertion point follows this whole dotted line. Put our eyes in over here, And that means that this end will get this end of the muscle will do the pulling, and this end, every single one, will be the anchor site. Okay, and then another rule from the first page is that I always moves to O, I to O. And so I want you to draw a line and follow the grain of the muscle, how I can move towards O. And you see, I'm not connecting this I to this O, because that would go across the grain. We want to kind of try to follow the grain of the muscle. I is going to move to O, and so our arrows are sort of spread anteriorly for this. So let's go back to our video. And if we were to do the same thing over here, my eye would be on this side here, and my O would be in this direction, all along here. So I'm hoping that you're getting the idea that we're going to move in this direction. And so move your scapula in that direction, and this is what you get. So the scapula is moving, and if I rotate this, let me start that over. See, it just moved back. If I rotate this, you can really see that the scapula is moving away from the midline anteriorly. Now it's putting it back, moving closer to the front side of the body. So we would call that scapula protraction. You can also indicate it as abduction, and you'll notice that that's what the app uses, scapula abduction. But this muscle would do protraction of the scapula. So based on this, how will this muscle move the scapula? I'm going to put in that it will move the scapula. The scapula is pulled towards the ribs. And what is this movement called? Protraction. Okay, and then I'm going to put in parentheses that for the scapula, this is also called abduction. So depending on which one you've learned for this movement, either one technically is correct, but we've been using protraction for the scapula. Okay, so the serratus anterior does protraction of the scapula. Does it also do retraction? And the answer is no, because the muscle would have to lengthen in order to do that. The I would move away from the O. That's not how it works. And so we would need another muscle to do the opposite action. Okay, so let's move on to our second example. Okay, so our second muscle is going to be this muscle right here, which is known as Tibialis Anterior. Some people call it anterior tibialis. And I'm going to go ahead and pull up our app for that. I've got it highlighted here in blue, so this is the one we're focusing on, Tibialis Anterior. And as I rotate it, you can see there are other muscles that will accomplish the same action. So they're also in this particular animation. So where does this muscle attach? And you can see on the upper end, it's attaching to the lateral condyle of the tibia. Okay, so we have that spot right there. On the lower end, it's attaching to, I'm not real loving where this is, but it's showing you that it's on the first cuneiform. So really what it does is it comes down and attaches to the inferior surface of the first cuneiform and the first metatarsal, but this one's pretty close to where it should be. So this muscle here attaches to the tibia and to the first cuneiform and first metatarsal. Okay, so I've written in here that the muscles attaching to the lateral condyle of the tibia and then also to the first cuneiform and first metatarsal. So now we need to answer the question, which of these bones is likely to be the movable bone? Is this lateral condyle region going to be pulled down towards your foot, or is your foot going to be pulled up towards this area or towards your knee? And I'm hoping it's obvious to you that your foot end will move closer towards your knee end. So which one of these is likely to be the movable bone? The first cuneiform and metatarsal. Okay, that's our moving side. So let's go ahead and put in our letters. This is our anchor end, so we're going to put an O there. This is our moving end, so we'll put our I there, and the rule that we will always follow is I to O. So here's our arrow, I will move closer to O. And that action will pull the foot end up towards the knee. What is this movement called? We're going to lift our first cuneiform, first metatarsal up towards the knee. The heel goes down because we're working at this hinge joint here. Heel goes down, toes go up. We've already learned that this movement is known as Dorsey Flexion. So let's take a look at our animation. And I'll go ahead and put play. Let me unhighlight that and I'll push play. We're watching this muscle here. What does it do? It does Dorsey Flexion. We were right. It's pulling the, and if you can't see, foot up towards the knee, and that's Dorsey Flexion. Let's go back to our notes and see. Now, based on that, this muscle also does another action, and I'm going to add to it and leave you in suspense for just a second. What other motion is accomplished by this muscle? How could we move this end here closer to this end here that's not dorsiflexion? So think about what are the other options for our ankle. We've got dorsiflexion, plantar flexion, inversion, and eversion. So one of those is the other option. We know one of them is already dorsiflexion, but one of those, either plantar flexion, inversion, or eversion, is the second action of this muscle. So I'll give you a second to think about it while I pull up another animation. All right, I hope you've chosen your answer. Here's our second animation. There's that tibialis anterior again, right there. And how will that move the foot? Here's your answer. If you chose inversion, you are correct. So it's going to lift the arch area up towards the lateral condyle of the tibia and create a pulling effect that will cause inversion. Okay, so let's go back to our notes. We'll fill it in, and we'll move on to our last example. And I really want to give you a better view of this muscle that we're working with and get our bearings on what we're looking at here. So let me pull up the animation so we can see what we're dealing with. Okay, so here's the same muscle, example number 3, from a little bit different perspective. Here's an anterior view of our skeleton. We see our muscles right over here. So as I rotate this to show you the same example that you have on your page, now you can compare that to your worksheet and see that's pretty close. Okay, so this is the anterior side of the pelvis, posterior side, obviously superior, inferior. So the questions are, where exactly did this muscle attach? Which of these bones is likely to be a movable bone? And based on this, how will the femur move? Haha, there's an answer already. So, where does this attach? We can see on the upper end that it's attaching to the ilium all along the iliac crest. And we can see on the lower end it's attaching to the greater trochanter of the femur. So I'm going to write in on our notes iliac crest and greater trochanter of the femur. Which of these bones is likely to be the movable bone? Well, our ilium does not move. Essentially, it's locked in place. It's our pelvis. It's our pelvic girdle. And so the moving side is going to be the femur. And so the next question really is, how will this move the femur? If we were to cause the pulling effect that we know, here's the O, here's the I, and if I draw an I to O, how is that going to move the leg? You have to understand what movements are capable, and we're capable of at our ball and socket hip joint. So move the greater trochanter closer to the iliac crest. And if you do that, you will get a movement called hip abduction, abduction. I'm going to write at the hip. So the femur will be pulled closer to the ilium. And that will cause abduction, abduction of the hip. So I would go ahead and put in our O's and I's, O all along this top end, I, the greater trochanter, and as we have discussed, I moves to O, which would cause hip abduction, and the femur will come out towards us. And lastly, just to illustrate that concept, here I have our model. I've highlighted the gluteus medius in blue. You can see we have some other muscles, and a lot of it is hidden, but you'll still be able to get the idea that when the gluteus medius contracts, it will cause hip abduction and pull that femur closer towards the ilium. So there you have it, the basics of muscle contraction. I would encourage you to really pay attention to these rules from the first page, because as hopefully I proved to you, it doesn't matter what skeletal muscle you're looking at, they all work in the same way. And as long as you're continuing to follow these rules, specifically 6 and 7, you really can't go wrong. There's not a lot that you're going to mess up if you have a really good understanding of these rules. So these are probably the most important rules of all the rules in terms of knowing how to identify actions. Okay, talk to you next time.